like the word sugi, which means I like you or I like it in Japanese. So I was born in Sapporo. So basically I was born in this deep power snow. I even eat deep power snow. I have very strong passion to understand anatomy. Then I became a surgeon and I illustrate this material to educate younger surgeons. Especially I was so obsessed with observation of the pancreas. I will tell you the reason later. So our AI platform, which is called the Eureka system, is simply designed to support surgeons' recognition or judgment or even communication within the team during the surgery. So this is important key slide. So the concept of the Eureka system is visualization of the surgical intelligence based on precision mapping technology. So I'd like to introduce one of the greatest surgical intelligence, which is about total mesorectal excision for rectal cancer, published by Bell Hill in 1982, which is exactly the same year I was born in Deep Paris. So this is actually image during the TME. So he described mesorectal fascia as holy plane for the dissection layer, and neurovascular bundle or high gastric nerves for preservation organ. And it took us 40 years to succeed, precisely visualize each single fiber of the connective tissue or network of nerves using AI power in real time. So Eureka box is physically the white box and which can receive the image from any type of the laparoscope or any type of the robot. And it can display AI visualization to additional monitor with a latency 0.1 second. So this is the movie performed by Professor Jun Watanabe. It's a TME procedure. So basically he's gonna explain his concept of the surgery at our booth 1215. So he make the proper tension between the mesorectum and preservation side, and he trace connective tissue and preserve the nerves network. So he trace each single of the connective tissue and preserve each single fibers of the nerves. So this visualization will shorten the learning curve of the young surgeons for sure. So what is the next step of the precision mapping, which is preservation organ? For example, the pancreas, which is my favorite organ, or ureter, or major vessels. So this is the moving of the pancreas recognition. So I have the question to the surgeon, what kind of scene you pay the maximum attention during the surgery? I think the answer is similar or the same scene you made mistake before. So this is the part of the pancreas I is recognized as adipose tissue and injure the pancreas, injure the patient who could not go out from the hospital. It was 10 years ago. So it's really important to teach this surgical attention to AI so that pancreatic injury will never happen, hopefully. So the same as ureter. Sometimes you didn't notice there is a ureter in the image and coagulate ureter. So Eureka system is implemented to 30 institutions in Japan and now is approved as medical device. And we are planning to do a clinical trial from this year. So Eureka system is supported by 30 institutions and a lot of expert surgeons in Japan. Now we are testing Eureka system outside Japan. So Eureka system is based on only Japanese training data at this moment. And how does it work outside Japan? So this is the scene Professor Jim Han in Portsmouth Congress used Eureka system as live surgery case and it's displayed into the audience. And we can beautifully visualize his procedure, which proves we have the same body. At least we have the same anatomy and the same pixel of the structure. And Professor Bill he is a father of TME, mentioned Eureka is an optical illusion made holy plan even holier. This means a lot to us. So I want to conclude to compare these two numbers. 15% is the complication rate in surgical treatment, and 0.0009% is the rate of the accident in air flight, which I believe the number of the safety future patient deserves. Thank you very much.